on the NewsChannel 5 network. This is Open Line.
Good evening and welcome to Open Line. I'm Emily Luxon. Thank you so much for joining us tonight. Tonight we are talking about all things COVID-19 and we have so much to cover. Of course, as information is constantly changing on this topic, we want to make sure we're keeping you updated on the very latest. We'll go through the latest numbers, both in Davidson County and in Tennessee. We'll discuss the mask mandate in Davidson County, as well as just the latest situation and your questions and concerns. We want to make sure that you are involved in this discussion as well. So we're hoping that you will give us a call over the next hour. That number is 615-737-PLUS. It will stay on the bottom of your screen throughout the show. So give us a call if you have any questions, any concerns, anything you want to ask that could maybe keep you safe, keep your family safe, concerns that you have. We want to hear from you. And our guest tonight, we're very excited to have him with us tonight, Dr. David Aronoff, an infectious disease specialist from Vanderbilt University Medical Center. Thank you so much for being with us this evening.
Thank you for having me on, Emily. I appreciate it.
Yeah, so we want to start kind of just get an overview here where we stand right now. I want to cover the latest numbers that came out today. Across Tennessee, we saw 1,212 new cases today and 12 additional deaths. And then in Metro Davidson County, 457 new cases were reported. That's over the last 48 hours because they had a delay in the numbers that they released. So that's over the course of 2 days. But when you hear those numbers, what's your general reaction? Which is kind of where things stand now.
Yeah, I mean, the numbers that we're getting both from our local government as well as from the state suggest that activity of COVID-19 is increasing day over day. So if we think about that flatten the curve concept, our curve is on the way up right now. We're having more cases each day than we had the day before, and I think that's a cause for concern.
Also, kind of on the national front, we've seen a similar trend. Heard Dr. Fauci talking earlier today that he says cases could go up to 100,000 a day across the country. When you hear that, it is a little scary. Does that mean we are in kind of a so-called second wave of this, or did the first wave ever end, or how would you classify kind of where we're at now?
Yeah, I'd say that what we are seeing now is an uptick of the first wave of this pandemic. What we saw was the arrival of the pandemic in the United States in the early part of this year. It hit Tennessee in early March, and it went up pretty rapidly. We saw cities like New York get hit pretty early and fairly aggressively, and then kind of start to flatten out across the United States and then just turn upwards. And so we really never got out from underneath the first arrival of COVID-19 in the United States or in Tennessee. So unfortunately, this is sort of an undulating first wave, and we're still kind of underneath the tsunami.
And of course, one thing that may help with this is a vaccine. Where do we stand on that? When could one possibly be ready?
Well, large clinical trials of vaccines are getting ready to start. So, for example, here at Vanderbilt University Medical Center, we are going to be participating in a rather large trial of a vaccine that is supposed to enroll over the United States around 30,000 people. That is due to start in July. And we'll have to see how that vaccine works before it can be, for example, a candidate that's moved into use clinically. And there's a number of these vaccines that are hitting these what we call phase 3 trials, which are essentially the large clinical trials to see, is it effective? Are we preventing infections when we use the vaccine? So that in and of itself is going to take time. We will immunize people, and then we'll have to see how many of those people, compared to people who don't get the vaccine, actually get COVID-19, analyze the data, and make decisions. So it could be quite a few months, if not an additional year, before we go from starting a trial in July to having a manufactured vaccine that's ready to go, which of course depends on the trial showing a positive result, which we don't know yet.
And as we get ready for the 4th of July holiday this weekend, a lot of people are going to want to see their families. They're going to want to travel. What would you recommend people do to stay safe? Is it safe to get on a plane? Is it safe to get in the car, take a car trip? Should you see your family? What would you recommend?
Well, I think right now, given the activity in the United States of COVID-19, it's still really important for people to do what they can, not only to protect themselves, but to protect people around them, and particularly people who they care about who may be at increased risk for doing poorly with COVID-19. That means our older adults in the community, people with chronic medical conditions like high blood pressure or diabetes. These are folks that can do really poorly if they get infected with COVID-19. As we head into the holiday, everyone's going to want to get back together and spend time close together. And what I'd say is, if you can, try to respect social distancing, keep your groups with small numbers, try, if possible, to wear cloth masks when you're together with people you don't already live with. Make sure you've got hand sanitizer or access to soap and water to keep your hands clean. And if you or someone you know is not feeling well, make sure that you're not participating in group activities and that you stay home or seek care. Whether or not to travel, I think, again, it depends on how much people feel they really need to travel during this time. I would say the time for recreational travel is not yet, particularly because all over the United States, we're seeing increases in cases, but particularly in the southeastern part of the United States, including Tennessee, we're seeing a lot more COVID-19.
And speaking of masks, of course, you knew we were going to get to that. We've got the mask mandate that went into effect in Davidson County this week, and then Sumner County leaders came out earlier today also stressing the importance of wearing masks. What would you tell people? Why is that so important? It seems like such a small thing, but why is it critical that we do this?
Yeah, this virus, we call it the severe acute respiratory syndrome coronavirus type 2, which is quite a mouthful, and we abbreviate it SARS-CoV-2. This virus spreads mostly from person to person through our breath, and it does so largely in respiratory water droplets, which to the naked eye are invisible unless you've ever breathed or spoken in front of a mirror or a pane of glass and you see that mist that forms. It's in that mist, that water vapor, that the virus travels. And even though it's invisible, those droplets are pretty heavy and they tend to fall out of the air within about 3 to 6 feet of our body, unless we are speaking really loudly or singing or shouting or sneezing or coughing. And what we really need to try to do is to prevent that cloud of virus from going from us to another person. So how do we do that? First is creating distance between people. That's really effective. And that's why when we had safer at home or people were really staying locked down, rates of disease were pretty flat. But when we can't socially distance and are around people in a range that they could be part of a chain of transmission, the other thing we can do is what we call source control. We can physically block the virus from getting out of our nose and mouth. And we do that in part by wearing cloth masks, which are very effective at blocking these respiratory water droplets from forming a cloud around us. And the biggest problem about this pandemic is that it is spread by people without symptoms. Yes, people who have symptoms of COVID-19 are the most contagious. If people have a cough and fever and shortness of breath from COVID-19, they're very contagious. The problem is that in the days before someone gets symptoms, if I get infected today, I may not get symptoms for up to 2 weeks. Most people get symptoms after about 5 days. But in that 2 to 3 days before symptoms start, we're actually making a lot of virus and shedding a lot of virus, but we don't know that we're infected. We're basically silently transmitting the virus around us. In addition, a minority of people who get infected, maybe 1 out of 5 or as many as 2 out of 5, never get symptoms. And even they can be part of the chain of transmission. So wearing a mask is a way to say, I might be infected, I don't know. But if I am, this is going to block my ability to transmit virus to people around me.
And of course, we're in the middle of a very hot and humid week here in Middle Tennessee. Is the weather a factor at all? Will the heat help us, not help us as far as trying to get this under control?
Well, we all know that cold and flu season is generally in the winter months. And there was a lot of hope that this particular coronavirus, which is somewhat of a cousin to cold viruses that are also, some of them are also coronaviruses, there was a lot of hope that this particular coronavirus would also exhibit this seasonal variation, and that we saw the pandemic start in the winter, and we hoped by summertime it would be waning. But it's important to know this virus has never really circulated in people before, and we don't know if it's going to exhibit any kind of seasonal variation. And so far, it seems not to be doing that. As we see, weather is warming up, and also the rates of the virus in our population are heating up. And so it doesn't appear that this is going to be seasonal. What we can say is that when the virus leaves our body and gets onto environmental surfaces, it's not very stable. It's actually very easy to disintegrate the virus with common household disinfectants or soap and water or hand sanitizer. But even over time, if left alone outside of the body, the virus will disintegrate over time. If it's in direct sunlight, the ultraviolet light from the sun will really speed that process up. So items that might have virus on them that are left out in direct sunlight get disinfected pretty quickly. But there's no evidence that if we are infected and we're in the sunlight, that we're going to get less sick or that we're more resistant to getting infected if we're out in the sunshine.
And another question people have asked me before, and of course, I'm not an expert, I don't know the answer, is if you get COVID-19 and you recover, can you get it again, or are you immune to it?
That's a really good question. And now we've gotten almost 7 months into this pandemic. And globally, there have been millions of people with documented infection, even in the United States, millions of people. And what we haven't really seen yet are large numbers of people getting reinfected, despite the fact that the virus is still circulating quite a lot. We think that once somebody recovers from infection, they have immunity. There may be rare exceptions of people who appear to get reinfected just after they've recovered, but I think that those are by far an exception to the rule. The question is, how durable is that immunity? In other words, if this virus is around next year or comes back again in the future, would somebody who's survived the pandemic in 2020 still be protected? Is immunity lifelong? We really don't know the answer to that question. And that's going to be important because even if vaccines appear to work, we're going to need to know, do they last forever? Do we need to give a booster shot at some point? So what I could say is that it doesn't look like people are susceptible to getting reinfected after they recover. It looks like they're immune, but how long that lasts is still up in the air.
And of course, it will be cold and flu season before we know it, which will be kind of another twist in all of this. How do you think that will impact the outbreak? And could it possibly cause confusion where if people start to show symptoms, they may not know what they have?
Yeah, cold and flu season generally starts in late fall. So we're talking September and October. And the symptoms of the flu and even some cold viruses can be identical to what we see with COVID-19: fever, body aches, fatigue, cough, shortness of breath, for example. So there could be a lot of confusion, and we're probably going to have to test people for multiple viruses during the cold and flu season. So here's some things. First of all, if you can get a flu shot in the fall, get a flu shot in the fall. It could be potentially devastating for somebody to be infected with both the SARS coronavirus that causes COVID-19 and something like influenza. To have both of those viruses circulating at the exact same time could have compounding bad problems for the public. So absolutely, if you can get a flu shot, get a flu shot. The other thing is that this pandemic has really reinforced the need to create some distance between ourselves and people we don't live with. We've moved away from shaking hands and kissing people on the cheek and hugging folks. And we're also paying very close attention to clean hands, making sure that we're engaged in hand hygiene. And we're wearing masks much of the time. So those behaviors, particularly the distance and hand hygiene, are probably going to reduce our risk a lot of getting routine colds and flus. So I hope that there's some benefit in the fall to all the behavior we've been practicing up to now. But for sure, we need to be concerned if multiple respiratory viruses are circulating in the population at the same time.
All right, we are starting to get some phone calls. I want to go to the phones to hear what people have to say here. Let's go to Angela. Angela, you're live on Open Line. Go ahead. Can you hear us?
Yes, thank you. This is Amber.
Oh, I'm sorry. Go ahead, Amber.
Thank you. I didn't answer because I didn't know if you meant me, but thank you. Yes, today I went to the eye doctor with my daughter. We both were wearing face masks, and as part of the screening, they tested us for fever. Much to my surprise, I registered at 100.6, and a few minutes later at 100.8. So we left immediately, and I'm wondering if it's advisable, that's the only symptom I have, if it's advisable for me to self-quarantine for my children and family and not go anywhere this holiday weekend, and if I need to get tested tomorrow at one of the local testing centers.
Okay, thank you for calling.
So much.
Yeah, go ahead, Dr. Aronoff.
Amber, thank you for asking that question. That's a really important question and a good one. And so at face value, for sure, fever in and of itself can be a symptom of COVID-19. This virus is very strange in that it causes a range of symptoms. Some people, as I mentioned, don't appear to get any symptoms at all, or the symptoms they get are so mild they don't even think that they may be infected. Other people may get, we've heard about loss of taste or loss of sense of smell, but fever is a fairly common symptom and can occur even in the absence of shortness of breath or cough. So if we weren't in the middle of a pandemic with COVID-19, I'd say you don't need to go get tested for it. But right now, for peace of mind and for public health, I think it's advisable for you to get tested. If you have COVID-19 that's causing you to have fever, it's likely that they could detect that with a proper nasal test for the virus. So I definitely would suggest doing that. And until you know, you should definitely self-isolate. Make sure that you're well hydrated, because of course, when we have fevers, we tend to lose more water from our body just by breathing a bit faster and evaporating a bit more from our skin and maybe sweating. So stay hydrated, contact a licensed healthcare professional, your physician or nurse, and let them know that you have a fever, that you were screened, you didn't even know you were having it, and that you'd like to be tested for COVID-19. But really good questions, and it sounds to me like you're doing all the right things.
All right, let's go to another caller. Go ahead, you are live on Open Line.
Hello?
Yeah, go ahead with your question.
This is Anaya. I'm just wondering, I'm a teacher, and I'm just wondering, is it safe for kids to go to school, or should they go back to school, or should districts try to focus on virtual learning just because the numbers have risen?
Thank you for the call.
Anaya, thank you for that question. That's a very good question. And, one of the things that we're experiencing right now with COVID-19 is that the activity of the disease in our state is not stable right now. It's increasing day over day. And so it's very hard to project how active the disease is going to be in our community when school starts. As a parent, I really am anxious for my kids to be able to go back to school. And it's good for kids to be with their friends and to be in that environment. But I think the question really does depend on what's going on with disease activity in the area. Children, as you know, are much less likely to get severely ill with COVID-19 or even to have symptoms of COVID-19 compared to adults. But schools are not buildings just full of children. There are staff, there are teachers, lots of adults are in schools, and lots of children are cared for by parents or grandparents or adults that themselves may be at increased risk of getting infection. So thankfully, of course, there have been a lot of online opportunities for engaging students, but that doesn't always work for every age group. And it can be challenging because some people may not have the technology at home that they need to engage in school in that way. And so ideally, schools are making plans about if we're able to be open in the fall, how do we set things up so that we can create some social distance, that make sure we have extra ability to engage in hand hygiene, think about what age groups or adults that may be able to wear masks safely. But it may really, as we get closer to school, be a bit of a game time decision as to whether those schools can fully open up their doors to a complete full schedule or need to be heavily modified based on disease activity. So I'd say nothing right now should be carved in stone about what's going to happen 5 or 6 weeks from now. And we all need to be doing our part to reflatten this curve, get the transmission of the virus under control so that we can maximize the chances that our young ones can be back in school.
All right, I'm going to go to another caller here. Ann, you are live on Open Line. Go ahead.
Yes, my question is about the testing results. When we get our daily results here in Davidson County and the state results, does it include, say, like today it announced 180-something inmates, and it may say 200 and something at the DuPont, or it may list the nursing homes. So when we get our state results, is that including the 5 counties or the 6 counties with their own health departments? How are we to determine what the real numbers are? That's my question. How do we really know what the numbers are?
Okay, thank you, Ann. We appreciate it.
And thanks for that question. That's a really important one that we spend a lot of time thinking about, because numbers can go up and that may reflect a hot spot like a nursing home or a prison or facility where people are densely housed, or it may really represent an area of a community that is experiencing part of the pandemic. So the state and county numbers include all of the tests that are positive and negative, whether they come from a facility where residents live together or whether they come from community members at large. But a couple things to say about that. One is that there are many dashboards available through the internet, for example, that the state provides information on, where we can actually look county by county at where the diseases were diagnosed and where these hotspots are. And then we depend a lot on our journalists, folks in the media, to go out and report to us that these are associated with a nursing home or a prison, and the state or counties often will let us know whether that is. So we have to be watching lots of sources of data to get exactly the full picture, but we can get county by county information on where the cases are, and generally can know, is this a facility associated hotspot or a neighborhood associated hotspot or something else. And I do think that that information is really valuable. And that's why I think for people in the community, keep your eye on the news, the local news, read the local newspaper, and go on the public Department of Health websites to get the latest information about how activity is in your own backyard and whether something is or is not associated with a facility.
All right, we're going to take a quick break and we will have much more with Dr. Aronoff right after this. Stay with us.